John Williams, Matters Pain Relief Centre again. We're going to be talking today about treatments of the sacroiliac joint. What is exactly causing your pain? So if we don't know what it is, it's very difficult to treat. So what we're actually looking at is a problem with sacroiliac joint pain. If we've done the examination and we've done everything and done our tests and there's no obvious cause, no reason why you got it in the first place, you just turned or something or just did a movement and all of a sudden you've developed this situation that's gradually got worse and now you're really struggling with it. Okay, so what we're looking at is we want some kind of pain relief. Okay, even if we don't know what it is, we know that it's painful, so we're looking at pain relief. So first of all, we need to split that into a couple of sections. Okay, first of all is treating the symptoms, and then secondly we're treating the cause, if there is such a thing, or if there is a cause and we have identified what the cause is. So first of all, we're going to treat the symptoms. So the first thing we have to look at is what can ease the symptoms of pain. You can take medication, analgesics and stuff like that, oral medication. But these will have some effect on you as far as side effects are concerned, and they're not really advisable. It's much better to probably look at a natural type of pain-killing situation where you will get some pain relief without causing any internal damage or making you drowsy, and things like that. So we're going to not use drugs in this particular situation. We're going to look for something a little bit more natural. Okay, so what we need to do first of all is to try and block the pain signals. The nociceptors are sending pain messages back to your brain and telling your brain that something hurts. Okay, in this particular case, we're assuming it's coming from the sacroiliac joint. So the pain is actually causing you some pain there. So what we have to do, there are various methods to be able to block the pain signals. Oral medication does that chemically, okay? But we're going to do it more naturally. So what we're going to look at really is the use of cryotherapy, which is ice. So ice is a natural painkiller. What tends to happen is, in a simplistic explanation that I'm going to give you now, is that pain travels down a certain pathway back to the brain to deliver its message. Okay, so it's a perception that something's painful and it's hurting, and it's sending a signal from the location where it is back to the brain to tell your body or to tell your brain that you have a pain. Now, the pain signals are deemed to be not important to the body. It's not a high priority, it's a low priority. And what happens is it's got different priority channels. So a bit like dial-up broadband and say cable, which is a lot quicker. So one of the other channels would be temperature. Now temperature, be it hot or be it cold, can be seen to be a danger to the body, because if you get a hot object and you put it on your skin, it's very soon going to damage your skin really bad and create a problem for your particular body. Whereas if you put a pin into that particular area, yes, it hurts, but it's not really life-threatening. It doesn't do any serious damage. So therefore, the priority will be the pain gets the quicker channel and goes, and the messages go back to the brain quicker. So if you have an area, let's say your knee or your sacroiliac joint or something like that, that's giving off pain messages and it's traveling back to the brain, if you put ice or heat over that particular area, that's deemed as temperature. So that temperature message will race the pain message back to the brain and arrive there first. This is, I'm trying to explain a very simplistic explanation so that the general public can understand this. So what happens is, by the time the pain messages arrive at the brain, what happens is it dials up engaged. So what's happening is actually blocking that signal. So while you have that temperature in place, be it hot or be it cold, the pain messages cannot get through. So therefore, you're giving yourself some pain relief. So it's an analgesic, okay? It is an analgesic. When you remove the temperature away from the offending area, what will happen is the pain will return, okay? So the question now would be, what is the best to use, hot or cold? We've established that both of them are going to kill some pain for you and make you feel better while they're on. However, it's what the difference between hot and cold does physiologically that makes a difference. So if you're using cold, cold will cause vasoconstriction. So the blood vessels in the area will shrink and go smaller and reduce the blood flow to an area. It will also, the law of physics states that hot will always travel to cold. So if you put cold onto an area, what happens is, first thing that's going to happen is you're going to cause vasoconstriction, a reduction in the blood vessels size, and a restriction of fluids arriving into that area via the bloodstream. You're also going to create a temperature gradient so that on the surface of the skin there's going to be something really cold. So the temperature below that in the body is going to start to head towards the ice or the ice pack, whatever you're going to use. So what happens is it has an effect of drawing temperature out of the body into the ice pack, because hot will travel to cold. So therefore what we're having is this: if the cause of your pain is an inflammatory nature, so you're getting pain and inflammation and heat and angriness and it's not happy at all, you're drawing the temperature out of that area and calming it down. Okay, you're restricting any more inflammatory material traveling via the bloodstream pouring into the area or the injury site, right? You're restricting that and you're drawing off, or you're dampening down the temperature within that area. So both of those things, as well as the pain relief that the ice is going to give you, is going to be a beneficial thing to you. If you're using heat, you reverse that. So yes, it will kill pain, but to start with, if it's killing the pain, which is okay, but it will also cause vasodilation. Now, vasodilation increases the size of the capillaries and increases the temperature in the body. So basically what you're doing is opening up the blood vessels. If inflammation is pouring into the area, you allow more inflammation to pour into the area if you're using heat. And you also, don't forget, we've already stated the law of physics is hot will always travel to cold. So what you're doing is pushing temperature, which is from a hot water bottle or a heat source, into the body from outside. It's because it's going in. Hot will always travel to cold. So if something's hotter on the outside and it's cooler on the inside, it will travel inwards. So what you're actually doing, if it's inflamed and angry, you're putting more heat into it. So in effect, it's like pouring petrol on a fire. So although you get pain relief initially, when you take it off, it'll be far worse. This is why when people play rugby or do physical sports and they get bashed around and they'll get into a hot bath, they feel fantastic. They'll relax, they feel great. But when they get out a few minutes afterwards or an hour afterwards, they can hardly move because that inflammation has gotten much worse and seized everything up. So if you're not sure whether what you need, ice is always a safe bet. Okay, so you're going to put ice over the area, which is going to kill some pain. So that's your first natural pain blocking mechanism that you can actually do, and also a way of, it's an anti-inflammatory or reduce inflammation. So ice is a great therapy for that. The next thing you can do to block pain signals, again, if you're just talking about pain relief, is electrotherapy. And in particular, either a TENS machine, which is designed to block pain signals, or you can use a machine called an interferential machine, which is far more powerful. Now, they're not normally used for domestic use, but physiotherapists have normally got access to one. And if you use them on the right frequency, which is the really important thing, they need to be used. It's like having a piano. You need to know how to play it. So if you've got one of these machines and you can use it properly over the sacroiliac joint, let's say we're talking at the moment, you can bang that frequency into that particular joint, because you can get right inside the joint with one of these machines and you can get at the source of the pain. You can get at the source of the pain. And that can numb the pain up and take the pain totally away. For a few hours, you can set another frequency on the machine, which will operate the ipoid mechanism, which is your own body's natural painkillers. So you get a more longevity of pain relief as well. So there's a couple of ideas that will help you with something like that. Okay. The last little bit we're going to look at is obviously what the causes are. Now, they can be many, and sometimes people will we call it etiology. What caused your sacroiliac joint problem in the first place? And it can be something and nothing. And most of the time, what we tend to see is the pain, the sacroiliac joint came on usually for something so insignificant, you think, well, I haven't done anything. I just bent down to tie my shoelaces up and bang, my back went. This is a really common thing that people say. If you do something really serious, like lifting something far too heavy or doing something like that, it's usually a back problem. It's not usually a sacroiliac joint problem. The sacroiliac joint problem, in my experience, tends to be something and nothing that's caused it. You know, you don't even know what's caused it. And that tends to happen an awful lot. So the causes are kind of a little bit woolly, you know, about what causes it. Bending and twisting is a typical thing you can possibly get it with. Golf swing, you know, does both of those things. And so we get a lot of golfers in with sacroiliac joint problems as well. The other thing, I suppose, you know, that could cause it is if you have an anatomical leg length difference, where you've got one leg longer than the other, it will tend to want to make your pelvis rotate to try and lose the leg length difference. Overpronation is like a little thing that, you know, yes, you could argue that could possibly have a mitigating factor in it all. But inflammation as well can come from a trauma, or it can come from a systemic disease. So if it's a systemic disease and it's inflammation, again, you don't want to be putting any heat on. You want to be able to take that temperature out, that inflammatory thing out. Sacroiliitis means inflammation of the sacroiliac joint. So when you've got inflammation, bang the ice on it. It will really help. Okay, and because you're helping calm down that angriness and that pain that you're going to get. Okay. Most of the time, as I stated before, the sacroiliac joint causes are a little bit woolly and they're unknown. So, you know, to begin with, you know, that's another story. That's a way of looking at it and trying to find out something that's causing it in your particular situation. If you have a sacroiliac joint problem, then things to avoid are swimming with breaststroke legs, because it rotates the pelvis and you've got long levers moving round and round, pulling on that sacroiliac joint. Sitting with your legs crossed is another thing that can create loads of problems for you, because you're actually putting a stretch on it. And your sleeping position. So if you sleep in the recovery position, it's a twisting type of position, which will affect it and irritate it if you have inflammation of the sacroiliac joint. You can probably help with something like that if you sleep on your side, if you're a side sleeper, with a pillow between your knees and in a slightly flexed knee position. So you're bringing your hips up a little bit, like the fetal position. And that will keep your pelvis stable. Sometimes you might move around a bit. You can also sleep on your back with a pillow underneath your knees, just to stop you turning over. Classic symptoms of sacroiliac joint pain or discomfort would be one-sided low back pain, radiating pain into perhaps the low back, buttock and thigh. Getting up from sitting is normally, you know, uncomfortable. Turning over in bed can wake you because the pain comes on as you twist and turn over. Trying to get your shoes and socks on in the morning, trying to get your pants on, you know, bending forward, trying to get down to your feet, washing your feet in the shower is a nightmare. Trying to swing your legs in and out the car is another classic symptom you can get. And the pain can actually, in some cases, radiate into the testicles of men, and they can get like a dull groin pain as well. So these are typical sacroiliac joint symptoms. If you have it both sides, sacroiliac joints on both sides, you need to look at something perhaps systemic, which is an inflammatory autoimmune disorder. Okay, I hope this has helped, at least giving you some insight, and perhaps some of you could get some pain relief with some of the ideas that I've just thrown at you. Thank you very much. Bye-bye.